I think it is coming. Obviously, it's something that we need to continue to monitor, and of course the Fijian government is very closely monitoring. I think if we look at where most of the cases have been concentrated in recent times, they have been in and around Suva. The number of people vaccinated in Suva has been quite significant. I think it's well over 50% of the target population. So obviously, as you see rates like 60 and 70% plus, that obviously does start to have an impact on the spread of the virus, along with other measures. Obviously, the vaccines in and of themselves are not enough. Isolation and other things are needed. But we're working closely with that. There's been a request for an AUSMAT team. That is something that we are very favourably disposed towards, and there will be announcements very, very soon once final decisions are taken. But obviously, that's another way we can support. AUSMAT teams, of course, provide assessments on the ground, highly qualified experts who then give all sorts of logistical support, advice, and then look at what other support might be needed.
So there's been a formal request now from the Fijian government for an AUSMAT team. You say that's likely to be granted. What sort of time frame are we looking at here? When can we expect an announcement?
I would anticipate we would have a decision within the next 24 hours.
Okay. What's the importance of that team? If it goes in, what's it going to do? And why do you believe it's a crucial part of what Fiji is trying to do to get this under control?
Well, it's just another part of the layers of support. So in the past, apart from vaccines, we've delivered things like PPE, we've delivered other equipment such as testing equipment, we've helped to fund locally acquired staff. On top of that, AUSMAT teams obviously are high-level specialists who go in and are able to really make quick assessments on the ground about what kind of improvements in procedures might need to be made, what kind of changes in approach might be advisable, and then obviously assessing whether or not further supports are needed in terms of equipment and personnel.
All right, and in terms of how it plays out from here, the Australian government has now said what will be 250,000 doses by the time this latest shipment arises. What's the plan from here? Are you going to continue to roll these out through Fiji, and is Fiji going to continue to be a top priority?
It will, obviously at the moment as they're dealing with the outbreak, but also the speed of how quickly they're rolling out those doses, I think means that it's very important we continue to provide more doses. We've committed to 1 million doses to the Fijian government, the Fijian people. We're obviously a quarter of the way there, so there's still a way to go, but we anticipate as we have access to more surplus vaccines that we'll be delivering more to Fiji and other parts of the Pacific.
Yeah, I wanted to ask about that because obviously domestically we've made some decisions. Those decisions are going to see more AstraZeneca vaccines essentially sitting idle, particularly given a lot of people aren't keen, it seems, to get AstraZeneca. Does that give the government capacity to ramp up some of its donations and its contributions to Pacific Island nations?
Well, those assessments are made on almost a day-by-day basis, but certainly a week-by-week basis. We consult very closely, obviously, with the Department of Health and the Health Minister, and those decisions are then taken. But I would anticipate that in the coming weeks and months, we certainly would be able to ramp up our efforts, not just in Fiji, but right throughout the region.
What do you make of the way Fiji has handled this? There's been quite a bit of criticism. I guess that's understandable, inevitable, domestic political debate in Fiji about whether the government has taken the right approach. It's decided not to go with a hard lockdown, saying that would be difficult to enforce and would be, financially crippling for a lot of people in the country. What's Australia's view? Has Fiji taken the right approach here?
Well, I think Fiji can be commended first for their very strong border shutdowns, which did protect their community for a long period of time, and so they controlled the virus. Obviously, sometimes the virus is able to find a way in, and that's what it did, despite the best efforts. I think that countries like Fiji find themselves in a very difficult set of circumstances when obviously there is a significant economic cost to shutdowns. Fiji, in particular, has already suffered a very significant economic downturn even before this outbreak as a result of their closed borders because they rely so heavily on tourism. So I think there are only difficult decisions before a government in those circumstances. I think in those circumstances they need to make the best judgments. Our job, of course, is to work with them. I think the really positive thing is the speed of their vaccine rollout, and I'm very hopeful that in cooperation with Australia and other partners that they will be able to get on top of it very soon.
All right, Minister, thanks very much for speaking to the ABC. We really appreciate your time.
My pleasure, Stephen.